Yeah, I was wondering if whoever wrote the affordability for NJ Get Covered Marketplace would elaborate a bit more on that. I think that's going to be important as well. So if you feel comfortable, jump off mute. If not, no worries.
Oh, I actually put that there. And it's because based on the person's, if they don't qualify for the New Jersey Family Care and then they have to go out into the marketplace, if they don't have the funds to be able to afford paying for something that they previously didn't have to pay for. And sometimes that's a matter of, when I've seen in the community, people making a decision on whether to get medication versus buy food, right? So we're faced with, or whether to pay, their rent, or a bill, something that the child needs. So this is one of those areas where it falls through the cracks. And then on the as far as the person, it's not that they don't want to have it, they just can't afford. And then what'll happen is, then when they go to file their taxes, they get penalized because of the tax laws and people having to have health insurance.
Yeah, definitely. And I think with the redetermination, just because you're no longer income eligible doesn't mean that you're not still just above that mark. And so that's going to be super important as people might have to navigate the marketplace for the first time.
Yeah. And if I
And
can just
oh,
add
yes,
to that,
go for it.
the barrier here is, even when you go to the marketplace, there's a very large possibility that you're going to be paying $0 premium. The difference is, with New Jersey Family Care, there is no deductible. You now have to pay a deductible, and you now have to be prepared to pay these copays. You have to be prepared to pay for your medicine. You have to now budget out. So that barrier of actually utilizing your health insurance throughout the year, because it'd probably be $0 down, but throughout the year, there are so many clients of mine I know who just do not touch their health insurance and only have it to avoid that penalty. So I definitely love that you put that up there.
Oh, thank you for clarifying that. In terms of the cost may be zero upfront, however, throughout the year, all of the expenses that they didn't pay before, it becomes super unaffordable for them.
Yeah.
Yes, definitely. A great point. I know internet access has come up a fair bit. And so thinking through how to meet that technological barrier and how we can prov- provide ways to get around it. I think I love this, how to define, measure success. I think and that's something we also want to work with this collective, is coming together on shared measures. So we're all going for the common goal. So stay tuned for that. That's something we want to work towards with you all in mind. I'm going to move on. These are all so great. And thank you for your answers. The final question, so if we all jump over to the third slide, is we want to think about who might be great for these trusted messengers. So Greater Newark area, we service East Orange, Irvington, and Newark, and Essex County. And so thinking about organizations in that kind of catchment area who might have this capacity or might be a great partner to kind of engage with, thinking about their staffing, events that they might be having. I know, LaCasa, you were talking earlier about it. Reach existing programs, who has ambassadors already in the community. And we'd love to hear from your experience which organizations you think we should be engaging with. Maybe they're already on the call. So adding some ideas there. So we're making sure we're working with everyone we need to work with.
And if you feel free to add your organization here, definitely.
Yeah, all anonymous, so it's good too. Yes, unbiased, neutral organizations, faith-based, definitely. And Jay Citizen Action, I mean, we've heard today how great that they can be, and a great resource for us all to kind of tap into. Yes, the city of Newark, definitely.
I got locked out of typing, but if someone can put PTAs up there for me.
Got it.
Yep.
Alan Amy Church, yes. The GEM
Maybe,
project.
Gemma Recreation Centers. Clinton Hill Community Action.
Yeah. The Office of Violence. Yes. These are all really great organizations. Head Start programs. Yeah. And I think thinking about particularly we have the NJ Family Care, and then we also have the Cover All Kids. So thinking about that population as well.
Gemma Program for Parents.
Brick City Peace. Yes. Yes. F2HCs and federally qualified clinics.
And the Newark Hospital Systems.
Yeah, I love this point here. I'm just going to make it big. I think the greater point should be partnership with several organizations in a series of events. And I think that's something we also aim to do with everyone at the table, is sharing out when you have events and sharing with a network so we can get as many people into what's happening in the city as we can.
I'm not able to type in my, I guess my company has it restricted for me to type, but I was thinking all 5 HMOs.
Mm. Nikki, I'm not sure if anything's happening in the chat.
Yeah, Yolanda read out some of the ones that were in the chat box, and they're added to the Jamboard, so we got you. There's also childcare facilities, and I'll add that in just a moment.
Thank you so much, Nikki. So as we create this amazing list of resources in our area, if anyone has any thoughts as we see this list unfold, and over the last 3 questions, want to come off mute and share any thoughts, concerns, anything like that, we'd love to hear from you.
Wix sites.
Gemma, this is Pete again from La Casa. I just think if we all start planning our own, if there was a way, like a working group, to plot out a series of events by targeted neighborhoods, and then we could kind of streamline, because my fear is there's going to be 3 events in 3 different wards, and it's gonna, right, because this is a labor intensive, it's not 5-minute conversations with people. This is 30-minute conversations with people. So it's definitely going to take, you don't want to water down the amount of people who can participate. Yeah,
I love that. And I like the ward specific approach too, and making sure that we're in those communities. And I think that's a great point, Pete, and something we should think about going forward. And those work groups might be by municipality or something like that, or by area or by group, to kind of narrow down who is involved and who can help spread the word.
Hospitals.
Any other thoughts?
Thanks, Evelyn. We also had someone share about the hospital systems in Newark in the chat box, so that's added. And then we just had a new comment where I'll add a sticky note about DCPMP and Perform Care to involve them in these conversations also.
Great.
Do we have local pediatricians included anywhere on this list on the Jamboard?
Not that I see. We'll definitely add that, Kendra. That's going to be super important.
I'm sorry, I was just thinking.
No, think out loud. We love all the thinking. So the Jamboard link is live, so it can keep on adding and collecting your thoughts. And we're going to take all these sticky notes and put some thought behind them. And, as we go forward, any ideas that come to mind, don't hesitate to reach out as we kind of think through how this might shape. But I might hand it over back to Yolanda.
Awesome. Thank you, Gemma, for that. Thank you, everyone, for participating. We're going to get you, a couple of people had to run, but we're going to get you with some final comments so we can all get back to doing the great work that we're all doing. So thank you for being patient. We're just at about a little, an hour and 11 minutes. So before I go, just by a hand of thumbs up or a clap, do you think an hour to an hour and a half, 60 to 90 minutes is sufficient? Because we want to be respectful of your time. Yes, okay, great. Because that's important to us that we make sure that we're including the people that we're inviting and being thoughtful of your time, because we do appreciate it. So thank you, Gemma, for that Gemma Jamboard. That's great. We're definitely going to take a look at that, and it's going to help us compile how to move forward. And how do we move forward? So the next steps are literally going to be us following up with you with additional information. We'll make sure to share that slide deck that we had earlier, and any additional information. Will also include the toolkits that were dropped in the chat, so that you have that information as well. One of the things that we also would like to do is we want to explore creating your interest, or rather I would like to know your interest in creating smaller affinity groups based on, different areas of the work as we move forward. So just by, you can come off mute or put it in the chat. I just want to know your interest in creating smaller affinity work groups. And what we were discussing internally at GNHCC is we'll have a bi-monthly large meeting like this, but then those that are interested in working in smaller groups, boots on the ground. I mean, I know we're all boots on the ground, but specific to certain initiatives and within the insurance. What are your thoughts on that? If anybody wants to come off mute to share if they're interested, or what do they even think about it? No takers? Any thumbs up, claps?
I just want to make sure I understood the question. Basically creating smaller work groups?
Yes, smaller work groups in terms of, so when we take a look at that Jamboard, areas that focus and comments that were focused in the education field, like we're thinking of having a group, one of the work groups being education in that field, a work group within the, somebody put on the Jamboard, working with the medical institutions, the hospitals, the Newark hospitals, that can be an area, CBOs. If we need to, it doesn't have to be. This is why we're asking for your input, so that we can see how we should move forward and going about that. And we wanted to spend the last few minutes, to see hear your thoughts.
Okay, thank you.
About that.
Yeah, I think this is Andrea. I think that's a great idea because, as previously referenced, this is a great work, and it's expansive actually, and to have core groups that meet a need for, I guess, approaching each segment of how this messaging and how this initiative is going to move forward. It's like we're breaking it into parts so that we all are working towards the same goal. And if you have a specific interest in working with the hospitals or working in faith-based or some other segment, you can really point your efforts in that direction. And I think it's a great idea. So, and I work good in groups as a background support person. I don't like to be in the front, so I'm with it.
Thank you for that, Sister Andrea.